I took the CDC data for Arizona, where I live, and plotted the excess deaths since August of 2021, the month when the first vaccine was adopted and approved. It took about 4 months for most people to get vaccinated, but since that time, excess deaths have steadily fallen until March of this year, when the excess death rate reached 0. It's stayed there ever since. The pandemic is over when the excess death rate is 0. The excess death rate reached 0 in March of 2022. So by this measure, the pandemic ended in March of this year. This tells us a lot about how we should act responsibly. Should we continue to mask and socially distance? Well, you certainly can if you want to. It's hard to prove one way or another how much of a difference it makes, and mask requirements can't be justified based on this data. But some people have always worn masks in public in cold and flu season, and I'm sure watching so many of their fellow citizens die over the last couple years did not make them want to stop. It's a free country, so they should take steps that make sense to them. Sadly, we need to acknowledge that things can always change for the worse. But currently, with the excess death rate at close to 0, clearly there's no reason to think that riskier interventions such as lockdown, school closures, are in any way indicated. The pandemic certainly showed off some of our divisions, but it also reminded us all that we are all in this together. As this tough time grows smaller and smaller in our rearview mirrors, I ask that we remember the recovery may look different for all of us. I'd like to close with an updated version of an old Hebrew prayer for the sick. Be blessed, and with the power of healing, and with the power of hope, fill our hearts with understanding, strength, and love. For best practice, I'm Dr. Dan Lieberman.